AIDS Collective. I'm going to give a couple more minutes to allow some more attendees to get onto the GoToWebinar platform. Just want to thank folks for holding and welcome new attendees onto the PrEP4Life webinar series hosted by the National Women and AIDS Collective. Just going to probably wait another minute or two to allow some additional folks to get logged into the GoToWebinar platform. Okay, great. I'm going to go ahead and get started. I want to welcome folks to the National Women and AIDS Collective PrEP4Life webinar series. This is our first cycle of our webinar series. They took place on Tuesdays, January 26th and February 2nd at this time, and thank you again for joining us. I'm today's moderator. I'm Liz Johnson, and I'm proud Executive Director of Christie's Place in America's finest city, San Diego, California. I've been the Executive Director at Christie's Place since 2002. We're a leading nonprofit organization that's committed to building the health and resilience of women, children, and families impacted by HIV and AIDS. I'm also very proud to serve as the chair of the National Women and AIDS Collective. I also serve on the steering committee for the 30 for 30 campaign, and I'm a member of the AIDS United Public Policy Committee. So for the webinar today, the National Women and AIDS Collective is the host, and our mission is to advocate and build the capacity of women-led and women-serving organizations and programs that work in partnership with women impacted by HIV and AIDS in order to improve their overall health and their quality of life. And about our webinar series, the goal of our PrEP4Life two-part webinar series is to help increase awareness of pre-exposure prophylaxis, or PrEP, and to provide educational information for high-risk heterosexual women, transgender women, young men who have sex with men, heterosexual discordant couples, as well as medical and social service providers. So just a little bit about our webinar platform. We're using GoToWebinar. All the attendees right now, you're in listen-only mode. Everyone can ask questions at any time using your question feature or your chat feature. And there's a graphic up here that kind of shows you where you can log your questions. During the question and answer segment, I'm going to read questions that have been submitted. So we're actually going to hold all questions and answers until the end of our session. I'll read the questions that have been submitted. Also, if folks want at that time of the webinar, you can raise your hand and I can unmute you to allow you to answer a question or ask a question, time permitting. Okay, and so this webinar series is about linking women to PrEP treatment. We have some great panelists today. The first person I'm going to talk about is Dr. Tracy Mack. Dr. Mack is a product of the Harlem community. She was featured by the Daily News as Dr. Angel in 2011. She's an advocate for underserved, providing quality care to patients who may not have had access to medical care. Dr. Mack treats high blood pressure, diabetes, chronic kidney disease, hepatitis, and HIV and AIDS. She's worked tirelessly to ensure Harlem residents receive quality medical care. She's given lectures nationally to consumer and physician audiences. When asked by one of her patients to describe her, it was said she's sensitive, caring, well-informed, and professional. Dr. Mack was the Associate Medical Director of St. Luke Roosevelt Hospital Center for Comprehensive Care for 7 years and is currently the Medical Director at Mount Sinai's Doctor's Faculty Practice at 147th Street and 8th Ave in Harlem. Dr. Mack is board certified in internal medicine, nephrology, and HIV medication. And she's on the board of directors of Iris House, a member of the National Women AIDS Collective as well. We have another presenter, Sarah, from Central Texas, who's 28 years old. She holds a bachelor's degree from Rashida University and works in consulting professional services. And finally, we've got Adrienne Phoenix from the Office of Women's Health. She's an ORISE Fellow at the Department of Health and Human Services Office of Women's Health. She joined OWH in 2013 as an intern and has worked on numerous research and writing projects, health campaigns, and national observances, including National Women's Health Week and National Women and Girls HIV/AIDS Awareness Day. She supports the Division of Strategic Communications, reviewing and researching health content for OWH's websites, and providing support for 2 of OWH's social media channels. So at this point, I'm going to go ahead and turn it over to Dr. Mack, who will talk about PrEP treatment.
Okay, thank you, and welcome everyone. Can everyone hear me okay?
Yes.
All right.
Yes, we can.
So, okay, so I'll go to my first slide, which is the agenda. What I'm going to talk about today is what is PrEP, how does PrEP prevent the spread of HIV, why is PrEP important for women, which women may benefit from PrEP, what is PrEP access, what questions to ask your doctor about PrEP, the importance of adherence, women's perception of PrEP, and finally some take-home messages. So what is PrEP? PrEP stands for pre-exposure prophylaxis. And prophylaxis is taking medicines before you are exposed to something, and it prevents you from getting the disease. Pre-exposure prophylaxis is a new HIV prevention tool in which an HIV uninfected individual will take an HIV antiretroviral drug medication before they have a potential HIV exposure to prevent infection. And it consists of taking this HIV medicine daily, and only Truvada has been FDA approved for PrEP. And an example of PrEP or an old idea would be women take birth control pills prior to sexual intercourse to prevent pregnancy. Truvada or tenofovir or emtricitabine is the only medicine currently approved for PrEP in the United States. And why was this medicine chosen? Well, there was multiple clinical studies showing that it worked, that one pill once a day actually worked, and that there were favorable safety and tolerability profiles, meaning people could take it and have less side effects. This is important because this is an HIV medicine, but it would be used in HIV uninfected people, and you don't want them to have lots of side effects. So how does PrEP prevent the spread of HIV? And what are some of the HIV prevention tools and strategies? So CD4 cells that become infected with HIV become little factories for the HIV, and it makes thousands of new viruses every day. The HIV drugs work by blocking HIV from making copies of itself. So if an HIV-negative woman already has HIV drugs in her bloodstream, when she is exposed to HIV during sex without a condom, this medicine might be able to keep the HIV from making enough copies of itself, and it may prevent her from becoming HIV positive. I like this cartoon because it shows there are many HIV prevention strategies. We have condoms, we have PMTCT, which is preventing maternal to child transmission, male circumcision, clean injecting equipment, PEP, which is post-exposure prophylaxis. We have condoms, treatment as prevention, and you see on the left-hand side, PrEP. So this is a nice cartoon that I like to show, which explains PEP and PrEP. So you have HIV exposure in the center, and after exposure to HIV, you may become HIV infected. But if you take post-exposure prophylaxis after the exposure, then that can also prevent HIV infection, and this has to be done in a timely fashion after the HIV exposure. Usually the earlier the better, but we say within 72 hours or earlier. And pre-exposure prophylaxis involves starting that treatment before the exposure. And on this cartoon, you see it's to the left, so it's way before any exposure. So why is PrEP important for women? There are significant racial and ethnic disparities in HIV infections that exist among women. This slide from the CDC shows that this disparity. For example, let's take yellow. White women make up 62% of the population, but they're only responsible for 27% of the diagnoses of HIV infection in 2004. Contrast that with the purple or the pink, which says that black women make up 12% of the population, but we're responsible for 44% of the HIV infections. And again, with Hispanics being 23% of the HIV infection, but making up 17% of the population of the United States. And also, PrEP is important for women because there are certain populations of women that continue to have high levels of infection. And this would be the trans women. This is a pie of all of the trans women who were newly diagnosed with HIV, and you can see 56% of them are black. 16% are Latina, and 16% were white. And the primary mode of HIV infection among women is sexual contact with a male partner. And this is shown on this slide, which Black Americans are on the left, the middle is Hispanic, and white is on the right. And it does not matter what your race or ethnicity is. The pink is heterosexual transmission, and in each of these pie figures, you see that 90% of black women, heterosexual, 86% for Hispanics and 74% in whites. And this was data from the CDC for 2013. Limited options that can be controlled by women themselves. So we depend on the male putting on a condom, and we really don't have a lot of options that we can control ourselves. What women may benefit from PrEP, and what are the benefits of PrEP for women? So any HIV-negative woman who is in a sexual relationship with a known HIV-positive male partner, or if the HIV-negative woman is pregnant, or she's trying to get pregnant, or if the HIV-negative woman is transgender and engages in high-risk sexual behaviors, or any HIV-negative woman who injects drugs or shares her needle equipment or engages in high-risk sexual behavior, if any HIV-negative woman engages in transactional sex, or any woman who has reported, HIV-negative woman who has reported at least one other sexually transmitted infection in the past year, or any HIV-negative woman who in high prevalence area of a sexual network. So I like this cartoon because it shows that you continue PrEP even during pregnancy and breastfeeding. And both of the medications, the Truvada or the component Viriad, they appear safe in early pregnancy when used as PrEP. And there was a study called Partners PrEP, and it showed no negative effect on the babies conceived when the mother was taking PrEP. And women who have been living with HIV and have been taking these drugs have proved that it's safe during pregnancy. So PrEP access. Okay, so are you ready for PrEP, and how can I start PrEP? First, you need to talk with your doctor to see if you are a candidate for PrEP. And your healthcare doctor or provider will do a series of tests to make sure that your kidneys and liver are working well, and will rule out different infections, sexually transmitted infections, and also make sure that you are not HIV positive. And then after the discussion, if PrEP is a good option for you, your healthcare provider will give you a prescription. And how do you pay for PrEP? Well, it's covered by most insurance programs, and you can also contact your health department or any HIV/AIDS service organization for you to get more information. And if you don't have insurance, your healthcare provider can direct you to assistance programs. This slide says not enough healthcare providers know about PrEP. And 90% did not know that daily PrEP could reduce the risk of sexually acquired HIV by more than 90%. And 1 in 3 of the primary care doctors haven't heard about PrEP. And daily PrEP can be reduce the risk of HIV infection among people who inject drugs by 70%. And let me go back and make a correction. Daily PrEP can reduce the risk of sexually acquired HIV by more than 90%. The problem is only 1 in 3 primary care doctors and nurses haven't heard about PrEP. I like this particular chart because it shows that we have increased PrEP use since 2012 and 13 in New York. And we did this by provider training, raising awareness, and actually ensuring that Medicaid covered the PrEP. So in 2012, you see that there were 259 beneficiaries receiving PrEP, and as of last year, that had increased to 1,330. So what questions to ask your doctor about PrEP? What is needed before PrEP is prescribed? And when is PrEP not given? So you want to ask your doctor how often and for how long do you need to take PrEP? And what happens if you miss a dose or several doses? And what would be the likely side effects of PrEP and how can they be managed? And how often you will need to be tested for HIV? And how much it's going to cost you? And is it all covered by my insurance? Or are the HIV tests also covered by my insurance? And before PrEP is prescribed, you need to have a negative HIV test. If you're already positive for HIV, PrEP will not be prescribed. You have to have normal kidney function. And a urinalysis is done to make sure that you are not leaking any protein, which could be an indication that your kidneys are not functioning normal. We want to make sure that you're not pregnant, and we want to screen for sexually transmitted infections, syphilis, gonorrhea, and also to screen for hepatitis A, B, and C. And if you do not have immunity against A and B, we would immunize you. When is it not prescribed? As I said, if you have a documented HIV infection, if you have abnormal kidney function, and if you cannot adhere to taking the medications. And the importance of adherence in PrEP. So tenofovir, which is one of the components in Truvada, reaches lower concentrations in the vaginal tissues as compared to rectal tissues. So for PrEP, adherence to PrEP is going to be more important for vaginal versus anal intercourse. And you need to take it one pill every day. If you take it inconsistent, which is poor adherence, that may increase your resistance. And for that reason, PrEP will not be prescribed if adherence is poor. This next slide, I like the cartoon because it shows that time for protection for rectal transmission or to prevent it, you need at least 7 days. But for vaginal protection against vaginal transmission, you need at least 20 days, which means that you would take a pill for at least 3 weeks before you would have the protection of over 90% preventing you from getting HIV infection for vaginal transmission. And what are some of women's perceptions of PrEP? A lot of women had a high level of interest. They wanted more options, and they wanted to know what methods that they can absolutely control. But there were some concerns about the stigma that somebody thinks I'm taking an HIV medicine, so I must be HIV, mistrusting the medical system, really concerned about the side effects, and lack of trans-friendly or even knowledgeable clinicians, and discrimination by clinicians of PrEP. So what are our take-home messages? PrEP is a choice. It depends on your situation. It may be a lifelong commitment, or it can be used only during your seasons of risk. It is one of many HIV prevention strategies. The more approaches we use, the better the protection against HIV. And individuals must test HIV negative to start and continue PrEP. And adherence is essential for PrEP to work, especially for protection during vaginal intercourse. PrEP reduces the risk of acquiring HIV, but it doesn't eliminate that risk. It does not protect against other sexually transmitted infections. It does not prevent pregnancy, and it does not cure HIV or function as HIV treatment alone for someone living with HIV. Kimberly Smith, who used to work at Harlem United, had this wonderful quote that says, "PrEP may not be for every woman, but it is an option for all women." And I'd like to just acknowledge Dr. Oni Blackstock, Dr. Gina Osario, the Well Project, and CDC Vital Signs for some of my slides. Thank you.
Great. Thank you, Dr. Mack. Next, we're going to have Sarah, who's going to be the next guest presenter. Sarah, you should be unmuted now.
Hi. Okay, so I would like to start by saying how grateful I am to be on PrEP through the Austin PrEP Access Project. I am an independent contractor at 1099, and I can't afford to get ACA-compliant health insurance on my own, and so Austin PrEP Access Project has been fantastic, really, really fantastic for me. I thought I would start by explaining why I'm on PrEP. I have an HIV-positive, serodiscordant, heterosexual boyfriend relationship, and I was told that he told me he had HIV on our third date, which was pretty shocking. I had not known anybody to be HIV positive who wasn't gay. I certainly didn't have any friends or family friends with that story, probably just because nobody says that they have it. So this was completely new for my world and everybody in my world. My family was terrified, and they wanted me to stop seeing this guy at that stage, and I wanted me to break up with him too. Anyway, we are almost at our 1.5-year anniversary, and we live together now, and we are very happy. And a big part of that is PrEP, because PrEP takes away the fear that I'm going to get it. And without that fear, we get to date like normal people. So within the first month of seeing this guy, we went to ASA, which is called AIDS Services Austin, to get information about what's safe and, you know, when to have fear, when not to have fear, what are the facts. You know, my parents and the older generation, they know that HIV is AIDS is a life sentence, and things have changed a lot. At the beginning, I wasn't ready to take the medication. I'm sorry, ASA had mentioned that there was medication that you could take, but it was in my first month of dating this guy, and I wasn't sure it would last. So I put it off until my sister, who is the bulldog of the family, quite frankly said, you know, if there is a medication that you can take to make sure you don't get HIV, then why aren't you on it? And that kind of really resonated and struck a chord, and so my boyfriend called ASA to find out more information about the medication they recommended. And about that time, Austin PrEP Access Project was starting up. I was one of their first 5 people last year. And I mentioned I don't have regular insurance. So there's actually a program for people like me where it's prescribed free. And like all new programs, there's a lot of confusion on various ends about how it works. And Awesome PrEP Access Project was terrific. I was one of the first 5. They were operating under the radar just to make sure they got their processes up and running before they started promoting themselves. So I got a lot of time with the patient navigator, who was wonderful. I got information up front of everything that I needed to bring with me to make the process as smooth as I could. And it was straightforward for me, and obviously I'm the side that was emotional about it. I know, because we talked about it, my patient navigator had a lot of problems with the pharmacy, with Truvada, or Gilead creates Truvada, and everybody on that side was confused about what was happening. And for me to not have to emotionally deal with that was so great. Can't explain. Really so great. So I go to the clinic. I pick up my medication once a month. I get my blood tested every 3 months to make sure I'm still HIV negative and that my kidneys are functioning and I'm not pregnant. And there's a set of routine tests that they do that I'm fine with them doing. They've really been amazing. I mean, it's a not-for-profit, so it's stressed for resources, and they are trying very hard to meet the needs in this area. There's a lot of need, and things are going very well. The one challenge I would say that they have is that they don't, their staff is all voluntary, you know. So I was just told yesterday, I waited a couple of weeks to get the results from my most recent blood test, and somebody was calling me to tell me actually about this webinar. But I asked for my test results, and she was surprised nobody had contacted me already, said everything was fine, and then said that the guy that I was used to dealing with had actually just left. So they're lacking resources for this terrific program. You know, my experience as a woman on PrEP, I don't know how different it is for a man. I'd say that we are more capable because usually at a point in our lives we have taken the contraceptive pill, you know, so we're used to that. Same time day, every day. It's not hard to get that through. So I'd say that the regimen of a pill a day has been easy for me. Having my blood drawn is no problem. And because I am a 1099 contract, I have very flexible hours. So one thing that's really amazing about Austin PrEP Access Project is that they are open during the week. I want to say it's 5:30 p.m. to 8 p.m. on Wednesdays, and then they have the weekend sessions as well to try and accommodate people who have 9-to-5 jobs, and you know, traffic is very difficult when you're coming into certain areas, very difficult. So they're trying to reach us outside of the clock, which I think is terrific. And I'd say that it's been fantastic. And you know, my family is not afraid anymore, which makes me be able to have a relationship. In, you know, it just wouldn't be possible without this drug. And
thank you.
Yes, that's all I've got to say about it. It's very important to keep the services up.
Great. Thank you so much, Sarah. And we don't normally do this, but we had a comment we want to share with you. One of the participants wrote, I just want to commend Sarah. Excuse me. I just want to commend Sarah for her frankness and willingness to be open-minded in her relationship. Kudos to her, and I wish her and her boyfriend the best.
Well, thank you very much.
Great. We're going to go ahead, thanks so much, Sarah, and turn it over to Adrienne from the Office of Women's Health.
Okay, thank you, Liz, and thank you to you and Vanessa for allowing me an opportunity to come on today. I am excited to talk about 2016 National Women and Girls HIV/AIDS Awareness Day and what we have planned this year. Before I do that, let me start by just giving you a little background about our office, if you're not familiar with us. The Office on Women's Health was created in 1991 to advance and coordinate a women's health agenda throughout HHS. We work with our partners to promote the health of women and girls through policy and model programs and educating the public and providers. Our mission is to help women and girls achieve the best possible health. We are located in Washington, D.C., but we have 10 regional offices, 10 regional women's health offices throughout the United States that help us promote women's health and achieve our goals. So today I wanted to talk to you about one of our national health observances, National Women and Girls HIV/AIDS Awareness Day. National Women and Girls HIV/AIDS Awareness Day is a national observance that's held every year on March 10th. 2016 marks the 11th observance of National Women and Girls HIV/AIDS Awareness Day. I'm really excited. This is my second year working on this observance. This year's theme is the best defense is a good offense. And this year we're focusing on addressing HIV prevention. OWH wants to encourage women and girls to put their best defense into play by taking some key steps to prevent HIV infection. We want women to use condoms consistently and be confident that they're using them correctly. We want women to know their status. We want them to go out and get tested. We are encouraging them not to abuse alcohol or drugs. And lastly, we want them to talk to their doctors or healthcare providers about PrEP or PEP if she thinks that she's at risk. So who are we hoping to reach this year? We're focusing on all women and girls, but specifically two audiences. We're focusing on African American women of all ages because we know that they face the highest risk of HIV and other STIs compared to women of other groups. And we're also focusing on young women ages 13 to 14 because we know that young women are more likely to have an STI and engage in unprotected sex. We're also building off of our December 2015 launch of our campaign, Know the Facts First. Know the Facts First is a national public health awareness campaign that's designed to provide teen girls ages 13 to 19 with accurate health information about STDs and STD prevention so that they can make informed decisions about their sexual health before they engage in sexual activities. So what is new for 2016? We updated our website and it's planned to go live on February 10th, so in just a couple of days. The website will include educational information for women and girls and lots of downloadable tools and shareable materials in both English and Spanish. Some of the things that we'll find on our website is fact sheets, posters, we'll have Facebook cover photos, we'll have a social media toolkit with pre-written messages, and we'll also have a walk toolkit, which will have ideas for observing National Women and Girls HIV/AIDS Awareness Day in your community. The website features videos from women who are also working to help us spread the word about how women and girls are impacted by HIV and AIDS. So be sure to check out our website and take a look at their quotes and take a look at their videos. So what can you do to help to observe National Women and Girls HIV/AIDS Awareness Day? Well, there's several things you can do. You can do anything from attending an Awareness Day event to helping us spread the word about the impacts of HIV and AIDS on women and girls on social media. We're encouraging people to be creative and just have fun with this. Visit our NAGAD website. National Women and Girls HIV/AIDS Awareness Day is kind of long, so we shorten it by saying NAGAD. So visit our NAGAD website when it goes live next week and use our materials and our social media toolkit. We're encouraging everyone to join our Thunderclap page. If you're not familiar with Thunderclap, it's basically one message that goes out to your social networks at the same time on the same day. So we're creating one for NAGAD this year, and we hope that you help us by signing up, help us get as many supporters as we can to blast out one mass message on March 10th. The final piece of our 2016 observance is our walk. We are planning our second Awareness Day walk here in Washington, D.C. on March 10th. Last year, we planned our very first walk, and we had some great lessons learned. We've included a photo here of OWH staff with the DC Mayor, Muriel Bowser, Justine Love, she's a local radio personality, and Mary Bowman, who's a local poet and activist. They all came out and walked with us last year. This year, we're also inviting HIV/AIDS activists, peer health educators. We're inviting some high school bands and college students, some cheer teams, more media, radio hosts, and staff. We just want everyone to come out and walk with us for HIV prevention on March 10th. The walk in DC will take place at the Sylvan Theater on the National Mall, and we're having an opening rally hosted by Danny Starr of Hot 99.5. We'll have on-site HIV testing and lots of other activities. If you're in the Washington, D.C. area, we hope you can come out and walk with us, and we encourage you to bring your colleagues, bring your friends, your sisters, your daughters. And if you aren't local, you can explore other NAGAD events that are taking place across the nation and consider reaching out to your regional OASH contact for activities that are going on near you. So remember that Thursday, March 10th is National Women and Girls HIV/AIDS Awareness Day. Save the date, put it on your calendar, sign up for our email alerts on our website. You can also follow OWH on Facebook, Twitter, and Pinterest, and feel free to contact me. I've included my email address here. So thank you, all of you, for your time today, and we hope to see you on March 10th.
Great. Thank you, Adrienne. Thanks, Adrienne. So now we're going to go ahead and open it up to our question and answer period. I have a number of questions that have been logged, so let me go ahead and start at the beginning. The first question was, what if someone doesn't know they have been exposed to HIV after having sex with a partner? Dr. Mack, would you like to maybe take that? Or?
Sure. Okay. What was the question? What if someone
doesn't know they've been exposed to HIV after having sex with a partner?
Okay. So that wouldn't be PrEP. I think that would be PEP. Because if you have sex without a condom and you wake up the next day and you say, oh my God, I think this person might be positive, or you're not sure, you should immediately go to the doctor, because they would test you to see if you are already HIV positive. And if you are, they would put you into treatment. But if you test negative and you think that you have a possible exposure, then they would prescribe PEP, which is more than just 2 drugs. It would be 3 drugs that you would take for 28 days to prevent you from getting HIV. This is called post-exposure prophylaxis, and it was open to the community, or recommended to the community, after 2005, where it was known that when doctors and nurses and hospital workers got exposed to HIV, needle stick, that this is what we took, and it prevented infection. And so that was occupational exposure, or occupational PrEP. And so now it's non-occupational NPEP that is being recommended. So I do tell my patients who are sexually active, they come in with a sexually transmitted disease or want to be tested, and they say this encounter happened a couple weeks ago. I then inform them that they should have come to see me before, so that we could have started PEP to prevent them from getting HIV. Does that answer the person's question?
I'm not sure. It looks like she may have left. Dr. Mack, will we have you? There's a couple of questions around resistance. There was a question. It's been one of the participants said, it's been my understanding that resistance only applies to HIV-positive people. Can the presenter clarify what she meant by resistance?
Sure, and that is correct. You only will build up resistance if you become HIV positive and continue to take the medicine of those two drugs only when you become HIV positive. If you're HIV negative, you can stop and start the medications and you will not become resistant. You become resistant to the virus, not resistant, taking the medications. Oh, I'm in a relationship now, I need it, and I'll take it. Then I stop, and I'm in another relationship, and I can start again. You will not build up resistance that way. You will only develop resistance if you become HIV positive, and that is why we test every 3 months to make sure that you remain negative.
Great. There was another question similar to that saying that last week's presentation conveyed a person cannot build resistance of taking PrEP inconsistently, and I'm assuming they mean like an HIV negative person. So I feel like you've clarified that.
Okay.
There's more questions around, Dr. Mack, there's a question around what 3 drugs are in PrEP?
No, it's only 2 drugs in PrEP.
Great.
It's Viriad and emtricitabine. It's only 2 drugs. When we treat HIV, we treat for 3. And so that's why resistance could build up if you become HIV positive, because you're on an under treatment for HIV with 2 drugs.
And there's a question around how long does it take PrEP to work once taken?
Okay, that was a slide I showed that for vaginal transmission, we recommend that you take it for the 20 days before you are protected over 90%. And that's, for women. For men or for rectal transmission, to prevent it, it's 7 days.
Great. I have a couple of questions for Sarah. Sarah, the first is, did you and your partner use condoms with PrEP?
Absolutely. We still use condoms. My boyfriend is very, very cautious and aware, and so am I. We don't have oral sex. Every time we have sex, we use a condom, but we don't have as much sex as we used to. I think after somebody gets diagnosed with HIV, there's a lot of mental stuff that comes with that. So, I mean, we have a sex life, but it's not, it's not what I used to have. But, yeah, we're very, very safe and completely monogamous. And I've never missed a pill. We actually were told when I started PrEP to be safe to take it for a full month before we engage in sexual relationships, just to make sure that it was fully throughout my blood and I would be resistant.
Great. There's a comment and then another question for you, Sarah. Comment was, just want to say a huge thank you to Sarah. I believe her story and feelings are shared by many, many others in our world today. Sharing her story will help others feel more confident to live their own. Thank you. And then we have another, thank you, Sarah, for your presentation. Oh, it just moved, sorry. A quick question, you said during regular checkups, they check to see if you're pregnant. Is pregnancy a challenge with PrEP? Also, is the program that helps with the medication funded permanently?
I am not sure if Austin PrEP Access Project has permanent funding. They are in a hospital, a St. David's Hospital in Austin, Texas at the moment. And I know their space is donated there. I would say that a risk is, I would say that maybe they're not. I really don't know, but you can, if you Google Austin PrEP Access Project, there's been a lot of media attention on them, and so I really can't answer that. And with regards to pregnancy, I'm not sure. It's just one of the things that they check for. But like I said, I use condoms every time, so I think maybe it's just in their panel of things to check, because a lot of people say they use condoms every time, but they don't, which was probably, me prior to this experience. So that's my feeling about that.
And actually,
also,
Dr.
this is
Mack,
Dr. Mack. Can I just interject?
Yes, there's actually lots of questions around pregnancy and breastfeeding, and so if you wanted to talk about that, that'd be great.
Sure. Okay. So we test for pregnancy just to make sure that if you do become positive on PrEP and you are still with the partner, we want to make sure that you stay on it and you take it's consistent. We have shown through people who were positive or infected or living with HIV and became pregnant that the drug was safe. So we're actually doing it to make sure that we counsel you that if you're still in that relationship, you still need to take it until the completion of pregnancy. And also, if you're going to breastfeed, the research has shown that it is safe. So those are the reasons why we test.
So that's great. There was a question here saying that someone had spoken to a representative from Gilead and that they said they don't encourage women who are breastfeeding to continue to take Truvada because the medication gets into breast milk. But the information you have is that it is safe for women who are breastfeeding, Dr. Mack?
Yes, but again, this is all these things are new, and it is, to my understanding, that you can continue it while you're breastfeeding if you are still having the partner who is positive. Again, you're trying to prevent you or from becoming positive and through breast milk the baby. So yes, you would still continue with PrEP when breastfeeding, and it's a discussion that you would have, with your doctor.
Great. There's a question about, are there any peer-reviewed studies around the impact of Truvada in PrEP and Truvada or PrEP and pregnancy? And I don't know if you know of any, Dr. Mack. If not, the National Women AIDS Collective, myself, or Ingrid or Vanessa could do some research and share that with participants.
Yes. Could you do that?
Yes, we will. So we don't have any of that available for the webinar today, but we can certainly look into that and send that out to participants. There was a question about, Dr. Mack, could you please clarify, why does it take 20 days for women and 7 days for men?
Yes, I don't know. There's certain theories that saying it's the mucosa of the vagina, but we don't know.
Okay. There's a comment from somebody, family planning is actually an option. Live your life as you deserve fully. We as care providers and organizations should support clients and their happy, healthy sexual lives. So thank you for that. Several questions around if the slides are going to be available from today's presentation, and they will be. I'll give you some instructions to that later on in the webinar. We have a question. It says that if 1 in 3 primary care doctors have not heard about PrEP, but we still see a minority discrepancy in HIV infections, how do we encourage women who may be at high risk to seek adequate PrEP information or prescriptions if less than half of primary care doctors are unaware of PrEP?
Yes, that is an excellent question. And the organizations that do continuous medical education with providers and also your local health departments are trying to educate everyone, providers, so that they know how important it is. What I would suggest for women who go to a doctor and they're seeing the 2 or the 3rd person is to really have that conversation and say, you could get information for me. You want to form a relationship or a partnership with that person, and so just because they are unaware, they may still be able to have the compassion and feel that comfortable for you to talk with them, and they can become educated about it. There are hotlines that the providers could call that they would talk them through it. There are different agencies. I just want to make sure that the people who aren't aware, once they become aware through their patients, that they are sympathetic, not judgmental, and if you come across that, then it's time for you to look for another provider.
Great. There's a question here. If a person is on PrEP and they're exposed to HIV, there is a chance the virus will not make copies. What happens to the virus in the body if it does not replicate?
If the virus can't replicate, it's going to die out. There are a couple instances where we've had people on PEP, post-exposure prophylaxis, because they were exposed. Then once they did that for the 28 days, we put them on PrEP. And then if they say, well, I've had an exposure, we don't have to put them back on PEP if they were taking it consistently, because that's enough drug to kill off the virus.
Okay, thank you. I believe someone had their hand raised. Let me see if they are available. Elder Antoinette Etienne, did you have a question you would like to ask? I've unmuted you if you wanted to ask a question. Okay, perhaps not. Great. It looks like there are not any other questions that have been unanswered, with the caveat that the National Women AIDS Collective will get some additional information around peer-reviewed studies around the impact of Truvada as PrEP and pregnancy, as well as breastfeeding. We've gotten lots of comments thanking the panelists, Dr. Mack, Sarah, and Adrian. And so at this point, let me go ahead and just close the questions out and move on. So this is pretty much the end of the webinar session. After the webinar, you're going to receive a link to complete a post-webinar survey. There was a little glitch in the GoToWebinar link, and so you're going to receive a survey. There's some static. Hold on one second. Let me see if I can mute some of the presenters. Thank you. And so you're actually probably going to get a link through GoToWebinar, but you're going to get a follow-up link through NWAC through a SurveyMonkey, and we'll ask that you please respond because it will help us determine the effectiveness of the webinar. Also, the PowerPoint slide deck and a recording of today's webinar, as well as last week's webinar, and a list of resources to continue your educational efforts are going to be posted on the National Women AIDS Collective website in the next couple of weeks. It is our goal to get it up by February 15th, if not sooner. And we want to thank you for your participation on the webinar today. Also want to let you know about membership benefits at the National Women AIDS Collective. We have general membership, which is geared towards organizations, and that includes capacity building specifically for members. It also provides access to policy papers and other intellectual property and information. We offer reduced technical assistance fees, continuing education units, and a reduced fee to attend any of our institutes. And our associate membership is designed for individuals. Also, benefits include capacity building specifically for members, continuing education units, and a reduced fee to attend our institute. And want to just thank everybody for joining our webinar today. Our email address is www.nwac/us.org. Our telephone number is there. And I think that's pretty much it. So I want to thank everybody again, and enjoy the rest of your week. Thank you.
Thank you.
Thank you.